Bismillahirrahmanirrahim. Today I would like to share the knowledge about Giardia. My name is Sarfraz Rahman. I am a PhD scholar in the Department of Parasitology. I would like to share the knowledge with references these books. Veterinary Parasitology, second edition by G.M. Urquhart, Veterinary Parasitology, 4th edition by M.A. Taylor, George's Parasitology for Veterinarians, 10th edition by D. White, D. Bowman, and last one is the internet sources. Please subscribe my channel and also push the button of bell icon. The class Mastigophora. This genera, the most important six genera in this class. The Mastigophora has the six genera: the Trypanosoma, Leishmania, Trichomonas, Histomonas, Hexameta, and last one is the Giardia. So today I would like to share the knowledge about this Giardia. So the Giardia, one of the species of parasite that infecting the small intestine of the mammals. So its first description of the Giardia was done in 1681 by Dutch microscopist Antony van Leeuwenhoek. The 200 years after Van Leeuwenhoek, in 1859, a rich physician, Willem Lambel, observed the Giardia intestinalis in stools of the children with diarrhea, and the believed the protozoa to be that the commensal and not responsible for pathology. The species was then named the Giardia lambelia in his name. So the waterborne outbreaks due to the Giardia was reported in Europe in 1960s and 1970s. The Giardia infect 2% of the adults and 6 to 8% of the children in the developed countries worldwide annually. The largest waterborne outbreaks of the diarrhea due to Giardia in USA. This one is the interesting information. In USA, the Giardia from the men, they gain the access to municipal water reservoirs, and it's successfully infect the wild animals, especially beavers, that act as a source of contamination of the domestic water supply. So the Giardia, this is the final host, man, wild, and domestic animals, and site is the small intestine, and species, the species in the people, the Giardia lambelia, Giardia duodenalis, Giardia intestinalis, or the Giardia enterica, and Giardia murus in mice, and Giardia agilis in amphibians, Giardia stacey in birds. The Giardia cysts are excreted in the feces of the dogs and cats. Dog and cats act as a reservoir infection for man, and Giardia duodenalis is also known as the Giardia intestinalis or Giardia lambelia. And infective stage is present in multinucleate cysts. Its distinct feature is that the large adhesive disc is present at the posterior flat surface and help in the in attachment with the epithelium of the intestine. And a lambelia cell has the two nuclei, and both of which actively transcribe genes. It is similar to the hexameta. Total 8 flagellates. 6 flagellates are free. 2 flagellates are attached with body posteriorly, and not cause the chronic diarrhea in men. So this is the life cycle of the Giardia, and the incubation period is 1 to 14 days, and this is the life cycle. In human or animals, excreted the feces. In the feces, the Giardia changes into the cyst, and these cysts, with the help of contaminated food or water, when the human being or animals eat, they Giardia cysts enter into the humans or animals, and in humans and animals these cysts changes into the trophozoites, and these trophozoites, the excitation in the stomach and duodenum and in the presence of the pancreatic juice, and these changes into the trophozoites, then trophozoites passes in the small bowel and multiply, doubling in 9 to 12 hours, and incystation occur. The infective stage is the Giardia cyst, and it is the simplest life cycle of the all human parasite, and no intermediate host is involved in the life cycle of the Giardia. So the pathogenesis, the definite determination of pathogenesis of the giardiasis is difficult, and ability of protozoan to cause the direct damage to the intestinal mucosa via adherence with the disc, and the disaccharidase enzyme reduction occur, and brush border that damage and release the giardia of the cytopathic substance like the thiol proteinase, which release of the cytokines and mucosal inflammation, and the genetic differences between the giardia isolate which may confer the virulence stage. So the clinical sign, the persistent diarrhea, intestinal malabsorption, fatigue, nausea, and the diarrhea or greasy stool, loss of appetite, vomiting, abdominal pain, severe enteritis. The epidemiology or the transmission, the ingestion of the contaminated water with the Giardia cyst, the transmission via surface water, facilitated by relative resistance of the cyst to chlorination, and Giardia ability to survive in cold water for weeks, and direct fecal oral contact among the children in the daycare, and sexual practices which include the oral anal contact. And diagnosis, the direct smear of the diarrheal feces, you can see the trophozoites with the help of microscopy, and fecal flotation with the zinc sulfate having the 1.1 specific gravity, and phase contrast microscopy that the giardia trophozoites and the cysts, and in case of the phase contrast microscopy is not present, then you can use the ligule solution at the edges of the cover slip, and that stain the trophozoites and cysts, and you can easily observe the trophozoites and cysts. The antigen detection kit, sometime in case of the clinical giardiasis, no trophozoites or cysts are present, but in normal stool has the cysts are present. You can use the antigenic detection kits, and IDEX SNAP test. It is routinely used by veterinarians, especially the diagnosis of the giardiasis in cat and dog. The treatment, the metronidazole, and 500 to 700 milligram per day for 10 to 35 days, 2 to 2.4 gram single dose, 2 to 2.4 gram quarter per day for 32 days. In case of the canine giardiasis, you can use the 22 milligram per kg orally twice a day for 5 days, and tinidazole, that is the 300 milligram per day for 37 days, 1 to 2 gram single dose, and 50 milligram per kg, and single dose in case of the canine giardiosis 44 milligram per kg once daily for 3 to 6 days. Albendazole that 200 to 800 milligram per day for 3 to 31 days, and 400 milligram per day for 7 to 35 days. In case of the canine giardiosis, that the 25 milligram per kg every 12 hours for a total of 4 doses. So the control, wash your hands before and after you eat, after using the toilet, after coming in contact with your own or someone else germs, such as changing a diaper, and prevention of the fecal contamination of the feed and water, and sanitation, and use of the disinfection of the environment, like the Lysol 2% to 5%, and styrenol that is 1%, and chlorine bleach, that sodium hypochlorite you can use the 1% also. So thank you so much.